I'm Angel Carlisle. I'm a nurse. I am the Total Joint Program Coordinator here at OrthoUnited Spectrum Campus. So after you meet with your surgeon and you are going to have a total or a partial joint replacement, you will come to an education class. We will educate you with everything you need to know before surgery, during surgery, and after surgery. Preparing your house, things to expect, the dressing, therapy. You won't have any questions by the time you go home. You will get up, you will walk, you will eat and drink before you go home. We'll make sure you're steady on your feet. You have our phone numbers if you have any questions at any time before or after surgery. You'll have physical therapy all the time. You'll be in contact with the doctors. Usually we have all your questions answered before you leave. If you have any other questions at any time, there's always somebody available. So when you come in for surgery, our pre-op and PACU nurses are pretty much the same. They've all been here since the beginning. Everybody knows what everybody's doing. We anticipate all your needs ahead of time. There's no questions. We all work seamlessly together. It's a great group. They're all compassionate. They care about their patients, and you will see that. You will feel that when you're here. This is an outpatient surgery center. From beginning to end, your time is only about 6 to 8 hours. We get you in, you do your surgery, we get you recovered, you're fully awake. All questions are answered before we send you home in that time, so you do go home and sleep in your own bed the night of surgery. So here at Ohio Specialty Surgical Suites, we were the very first outpatient surgery center certified by Joint Commission for our total joint program. In order to get that certification, we do a lot of extra things and to keep it. So we prepare you really well before you have surgery. We have our education class we bring you in. You're prepared, you know what to expect before, during, and after surgery. There's no surprises. All your questions are usually answered. We have somebody on call all the time if you do have any questions. But we do have you see therapy ahead of time. We do get you up, walk you before you go home. You eat and drink, everything's in and out that fast.